Back on MorningLine. Thanks for joining us on this Tuesday. Good show. I think we're helping folks and trying to get to the heart of the matter for those of you with the Affordable Care Act and enrollment coming up. Unless you're under one of the exceptions, January 31st. With us is Sharon Barker and Mary Moore, both of them with Get Covered Tennessee. They're here to help you through the process. We're taking your questions, but we have the number up on the screen. We'll let you know how you can contact them if you have a more detailed question along those lines. And in terms of, you guys get, what, hundreds of calls every day?
Well,
maybe not that many, dozens of calls every day?
Yeah, we get a lot of calls because people really want the in-person assistance. They actually find that it's so much easier of a process to have somebody sit down.
To have someone, I would be calling you.
Yeah.
I mean, I really would. And I don't know, care what your education level is or otherwise. As Joe said at the beginning, it's confusing for everyone. It just is. So don't feel, well, I should know this, I'm not calling for help. You aren't alone. Let's go next, as I promised, Jill right off the bat. Jill, good morning.
Good morning, sir. How are you?
Hey, good, Jill. How can we help you?
Okay. Thank you, ladies, for taking my question here. I'm concerned about my health care coverage for this coming year. I have called in to TennCare to see if I'm covered, and I got hurt on the job, and currently I do not have any insurance. Going into that, I have a workers' comp case for that, but my general family care practice, I have zero insurance. That being said, I called the marketplace for insurance coverage, and with my income, I'm definitely covered, but then they said by the state of Tennessee, I'm accepted, but the state of Tennessee does not wish at this time to cover me. What do I do now for insurance?
So, when did you call the marketplace to do your application?
A couple of months ago.
Okay. And it said you might be eligible for TennCare?
Yes.
Okay. Do you have a child under 18 in the house?
No, ma'am, I do not.
Okay. Are you single?
Yes.
Okay. Most single adults do not qualify for TennCare.
Right.
So, there might be, some reason that you got that eligibility determination, but it could have also been before open enrollment started. When you did your application, if it was before November, and that might be why you didn't get a chance to pick a plan. But I think maybe another application would be in order.
Okay.
Is your income at least $250 a week, or?
I mean, right now I got hurt on the job, so I'm completely out of work. Period.
So you're not getting workers' comp benefits either?
Just as in November, I took off of that.
Okay.
Oh, okay.
Yeah.
Okay. Yeah.
So without that, you would most likely, unfortunately, fall in what we call the Medicaid gap. And that's essentially when your income is too low to qualify for the financial assistance on the marketplace. And like Sharon said, for one single person, your income has to be about $250 a week, about $1,000 a month, or $12,000 a year. Now that's gross. That's before any taxes are taken out. If your income is under that and you don't fit into a TennCare category, then unfortunately you're in the gap. And those TennCare categories are having a child under 18 in the house that you're primarily taking care of, being pregnant. Then there's some disability categories if you've been determined disabled by the Social Security Administration. And there's some other categories like if you have breast or cervical cancer. Unfortunately, outside of that, because we did not do Medicaid expansion as a state, which was originally part of the Affordable Care Act, but our state declined to participate in that part. What Medicaid expansion would have done is eliminate the categorical requirements for TennCare. So if you were under the income, you'd automatically be eligible. Now, what the marketplace may have tried to explain, because the result that you'll get when you do a healthcare.gov application when you're in the gap, a lot of times will say your state had the option to cover you, but they declined to participate in Medicaid expansion. So that may be what your eligibility letter said, talking about the state not accepting you. It wasn't you personally. It applies to everyone in your situation, unfortunately.
So if she's in the gap, and then she has to wait until a circumstance changes, perhaps, for her. Now, by the way, you said, your workers' compensation or whatever ran out. So are you still messed up so you can't work?
Exactly. I'm still seeking treatment from my doctor, and getting physical therapy and going backwards and forth from my doctor.
Well, at some point, then you may want to apply for SSI, or Social Security Disability, rather. I don't know if you're permanently going to be disabled. Now, again, as our guests have made clear, and I know this, just applying for that, you may qualify, but it takes months.
Yeah.
It takes a long time to get approved for Social Security Disability, but that's something to consider if you're in this gap, or hopefully you get better and can go back to work and make that $250 a month, and then she would qualify. Now, if that happens for her, is there any kind of an exception for her? Okay, that she would, because I know this deadline is January 1st. Let's say she goes through this treatment and all of a sudden then 3 months from now the doc says, okay, your back's better, you can go back to work. She can apply. That would be an exception to get back into the marketplace.
Yes, there's a special enrollment period for people who live in non-expansion states who were in the Medicaid gap during open enrollment and then leave it. Then they're eligible to purchase.
So those are some of your options there. And again, we'll have the phone number up at the end of the program for both they at Get Covered Tennessee, so they can help you through that process. And if you are in that gap and you need to find some type of help, Health Assist, we'll have that number, and they're the safety net that will send you to local places in your county that can help you with medical care on a sliding scale. And again, there's the numbers up. If you grab your pen and paper, we'll put it up again later, but 1-844-644-5443. And then we've got Health Assist at 1-800-269-4038. And Sharon said she would give out her home phone number before. Just kidding. Wouldn't that be awesome? You are so committed. All right, let's go to David. David, good morning. Hi, David. Are you there, Dave? We got David on line 2, and he may still, sometimes they step away. I'll put him on hold. We'll see if we can grab him up. I was looking at some of the other reasons, again, to explain the reasons ACA is unaffordable for some consumers. Now, we already said the Medicare gap. What's this one? They didn't work with a navigator when they enrolled and weren't aware of discounts associated with the marketplace. So that's where navigators come in handy. Talk about that, the discounts, and maybe they weren't aware of that.
So there's two types of discounts with insurance through the marketplace. There's premium tax credits, which help lower the monthly bill. And then there's cost sharing reduction, which helps lower deductibles, co-pays, out-of-pocket maximums. And the cost sharing reduction is really critical, because some of these plans might have a $5,000 deductible initially, but the cost sharing reduction could bring it down to zero or maybe only a couple $100.
Based on what? That would be
income.
Holy cow, that's a big deal. So,
but to get that cost sharing reduction, that second piece, you have to choose a silver plan.
So we were talking about that before you got here. No, but it's good you touched on it again here.
So if you if you're calling over the phone maybe, or you're looking at it on your own and you just start looking at the least expensive plans, those are going to be the bronze plans.
Exactly.
So
and
they
that's
will
where
have
I
the
think
lowest.
people did not understand. That's why you need to go with the navigator. We just have 3 minutes left, but you go with the bronze plan, okay, that's going to be a lower premium. You go, great, lower premium. Well, then you get hit in the face with a $5,000 deductible. So that's why you may want to consider paying a little bit higher premium for a much lower, and especially if you get these credits, deductible. Everyone's situation. If you're super healthy, maybe go for the bronze, because you're never going to use it anyway. But if you have issues, going for a bronze is just not smart. Don't go cheap. Find a way, because in the long run, I say that, it's cheaper to go silver. Right?
I think so.
I would think so. Dealing with navigators who can maybe bring those points up. Again, the hours and people can reach you. Let's put up the numbers again, as we just have a couple minutes to wrap up the show. They can call Get Covered Tennessee, I guess, weekdays. When to when? You don't have like a 24-hour hotline.
It's not 24 hours. 8 to 5. And then if somebody can't take the call, if they're busy, there's a voicemail, and they get a call back within 24 hours.
And as I imagine, you're busy, but you'll get back to them, and then you can go over it and then hopefully walk them through that. And I'm sure you'll get a little more busy as we approach January 31st. So, but make that call. And then, do you know how it works with Health Assist? Same kind of a way. It's an 800 number. But if you call that, leave a message or otherwise, and then again, Health Assist will put you in touch with entities out there to help you if you're not eligible for 10 care of the marketplace. All right. Any parting shots, just an emphasis for the folks in terms of information they have to have available when they start to do this right, and anything else?
The library schedule. Well, the library schedule will be good to get, because we're going to be extending our our hours on the 31st so that we can make certain we're there till like 11 at night on the 31st
Where?
at Family and Children's Service.
Okay.
We'll be enrolling there from 5 to 11.
Well, what's the library schedule?
The library schedule.
Yeah, that, you mean what library?
Yeah, so
there's
these
a
are the
bunch
days. Yeah.
Oh, you got a bunch of libraries that are
Yes.
going to have if you go to these libraries,
An assistant, a navigator. can
there'll be a
help you.
navigator there at these libraries.
Yeah.
And again, that's like Hermitage Library on Mondays, Madison Library. Most of the libraries in the
Yeah.
Davidson County area
Absolutely.
will have hours for this. Check with the library.
Yeah, these are posted at the libraries that are participating.
That's
so
awesome.
Go to your
well,
local
you guys,
library.
for a complex system, I mean, this really, you do a really good job, and you shouldn't be intimidated by calling them to walk through it.
And you're a good navigator too. You've answered all these
I'm
questions.
learning from you both. I'm learning from
Would you like
you
to
both.
volunteer?
telling you, we can use
could
this
use some
guy.
extra
I
help on
would
the
come
31st.
to maybe some comic relief, but anyway. Mary, thank you for joining us. I know you just caught the second half, but
Thank you
this
so
was
much
great.
for
I think we
having
helped a
me.
lot of people, and Sharon, you're awesome. You are awesome.
right.
And listen, let's do this again, especially if there are changes. We need to have you guys on more often. So if you're willing to, we'd love to have you.
Yeah.
Love to have you both.
Yeah.
Okay, great.
Be back with a programming note about tomorrow right after this.